All right, we have some before and afters that I'd like to share with our viewers of what we're talking about. So let's show what we have here and tell us the difference.
So this is obviously a patient with very small breasts. She's probably about a small A cup.
There you go. That's Olga. I'm an A.
And we went with, I believe this was about a high-profile 280cc implant. That took her up to about a full B, small C. And like I mentioned earlier, the average implant size has come down since I have been in practice. We are putting in smaller implants, and it's more, we are shaping the breast more than just stuffing it now.
Okay. I think we have another one. Let's see the before and afters here as well. And let me tell you, they really are a nice change. Go ahead.
Thank you. So the big emphasis and what all my patients ask for is cleavage. One of the most common—
I don't have cleavage.
Most common concerns my patients have is, doctor, I want as much cleavage as possible.
I know.
Because they want to be able to wear a low-cut dress without a bra and have it look beautiful, have it look voluptuous.
All right, and obviously you could see the cleavage. And it does make a difference, especially when you're wearing a bikini.
Absolutely.
Or a low-cut dress. It does make it more sexy, as we say. Do you sometimes tell people, well, wait until a certain age? I feel like younger and younger people are doing this, even some teenagers, which I don't know about that one.
Right. The saline implants are FDA approved for 18 and older. I don't get a lot of the teenagers. My average breast augmentation age is probably 24 to 35.
Okay. 24 to 35.
Yes.
And would you get more, let's say, older women who want to do a lift?
Well, there's younger women that need lifts, and there's older women that don't. I did a breast augmentation about 3 years ago on a 78-year-old.
And we're going to be talking about lifts in just a few minutes. How long does the surgery take, just out of curiosity?
Breast augmentation without a lift takes about an hour.
Oh, that's it?
That's it.
Excellent. All right. And sometimes you hear about things rippling, bubbling. What does that mean?
So rippling is when you can actually see little pleats form on the side of the breast from the implant. It's more of an issue with saline implants, specifically in very thin patients that don't have a lot of breast tissue. Ultimately, the more breast tissue, the more muscle you have covering the implant, the less risk of rippling you see. And the analogy I use is, imagine that your sheets are unmade. You've just gotten out of bed and your sheets are unmade. If you throw the comforter over them, you can't even tell if the sheet's made, if it's not made. But if you just put one little thin sheet over it, then you can see all the imperfections, all the wrinkles. So
great analogy.
The more breast tissue, the more muscle that you have covering the implant, the less risk of rippling.